The United States cannot afford to invest 17, 18% of GDP in healthcare. And it's not really healthcare, right? It's rescue care, it's disease management. And conservatively, a quarter of it is wasteful.
Healthcare is ever evolving. What we know today will be different than what we'll know tomorrow.
The payment models are changing, patient expectations are changing. There's a lot more data out there about how we're doing and providing care.
We're on such a wheel of how many things do we do to how many people and how quickly do we do it, such a production cycle.
I see this almost as a great debate. How do you foresee what obstacles may come? How do you circumnavigate them?
How do you manage the entire population, not just in the hospital, not just in the clinics, but across this continuum of care?
How do all of these folks stay aligned with the goals and stay aligned with the culture?
Traditional healthcare is low volume, high margin. New healthcare is high volume, low margin. So it means we are turning it on its head and having to think differently about how we provide services.
Change is hard, and it's not easy to do, but it's something we need to do because healthcare costs are too expensive and unsustainable in the long term.
That's the biggest obstacle. Prepare for the change and then be able to overcome it.
A lot of healthcare is scientific and technical, but to really make change, it's changing hearts and minds that make change and transform organizations.
The transformational mindset really starts with a willingness to be open to change, a willingness to make things better.
You have to involve people from the start. If they don't accept what's coming as a best practice and help mold that best practice, they're never going to accept it.
If it really changes the way I approach my work, if it changes the way I interact with other members on the team, that's where a transformational mindset is required.
In the future, I think our market share will be based on how many people sign up for your system of care because they feel supported in that system and because you're there to keep them healthy.
We're willing to take calculated risk. We're willing to lean into the storm, even though we may not know what that may mean.
Push the boundaries of what we know, push the boundaries of what we're capable of.
It's about looking at a patient, not in each silo of care, but if I look at this patient, no matter where in the system he or she touches, are we doing the right things? Are we providing the right clinical standard? Can I measure that? It's really the truest sense of changing the community and taking a responsibility for it.
Molina is a very complex organization. We have over 90 clinics, 13 hospitals, over 26,000 employees. We are the largest health system in the state of Minnesota. Molina used to be called Molina Hospitals and Clinics, and now we're called Molina Health. We didn't make that change before we felt that we could deliver on the notion that Molina represents health.
Well, current responsibilities, really, I look at it as trying to support our 26,000 person care team. So it's really how do we give them the support, the tools, and the vision that they need to transform healthcare.
Cardiology is an amazing field. There's tremendous amounts of data, and we can take that data and learn from it to improve people's care and outcomes. And I love that I can see patients in clinic and identify areas of opportunity, and then I can work on the outcomes and quality side to translate that to improving care for a population of patients.
So essentially there is no chest pain unit on the weekend, right? So she'll just be monitored over
Right, so
and then if she rules
out,
she's
already ruled out. So we think he can go home with a stress test on Tuesday in Cambridge.
Okay.
Postoperative atrial fibrillation is one of the most common complications after a cardiovascular surgery. And we realized that there were opportunities to improve that care by standardizing the care. We realized that there was a lot of variation depending on who was called, whether it was a cardiologist at night or the cardiovascular surgeon or sometimes the hospitalist. The care was different and the management of that postoperative atrial fibrillation was different. So we developed a standardized protocol and we worked with our electrophysiologist to implement that. We also looked retrospectively at what the baseline was. So at baseline, if you have postoperative atrial fibrillation, it increases your length of stay by about 2 days, and it increases cost by over $5,000.
Craig has used the enterprise data warehouse to abstract results from cardiac echo studies and identifying those folks that have aortic stenosis directionally going to critical aortic stenosis and making sure that they simply just get followed up and they get followed up appropriately.
By implementing this protocol and having consistent, standard, timely care, we've been able to reduce length of stay for these patients by about 2 days. So their atrial fib is managed better, gets under control, and are discharged from the hospital. We have decreased costs for the patients by about $8,000. So it really has been a huge success. The nurses have been satisfied, the care and quality has been excellent, and we've had savings for the hospital.
If you look at the curve for mortality associated with aortic stenosis, it's a cliff. So you sort of perk along okay, and then the mortality accelerates very quickly. And so we've seen, by virtue of actually scanning our electronic medical record in a more efficient and proactive way, a reduction in mortality associated with aortic stenosis.
Craig Strauss, who's well-grounded in this quality improvement work, and basically can say, gosh, if we do this consistently well, I can show you and I can demonstrate through the data I have at my hands that we're not only improving lives, but actually we're reducing mortality, avoidable deaths in some of these instances. So when you think about in the individuals affected, when you think about their family members and their circles affected, when you think about life years given for those individuals, it's about as powerful as it can get.
Clinical management of atrial fibrillation, particularly new onset atrial fibrillation. Our enterprise data warehouse updates regularly. Many of the data fields update every 24 hours. And that is tremendously valuable because it gives us essentially real-time data to understand what's happening in our population now. Minneapolis Heart Institute has a group of cardiologists that are very eager to be on the cutting edge of cardiovascular care and to deliver the optimal care at the right time and in the right setting. And so there's an eagerness and a willingness on the part of my partners to participate and to share in the ideas that we come up with and to implement them. And I think that's a tremendously important part of translating data into meaningful change. It also takes leadership commitment with Dr. Bachwig and within the health system with Dr. Wheeler and Dr. Seeloff, and they've been very supportive, and that's been helpful.
When I look at procedures and devices, you know, the way we treated a heart attack when I came out of medical school and the way a heart attack is treated now, it almost couldn't be more different. And so we were very comfortable with certain types of change. Where I think the transformational mindset is needed is when the changes are outside those areas that we're comfortable with making change quickly. So if it really changes the way I approach my work, if it changes the way I interact with other members on the team, that's where a transformational mindset is required.
The transformational mindset, it occurs at all levels, right? So everybody has a role in that. But you can see it all the way from the bedside to the boardroom. And I believe our board of directors is likewise energized and engaged in that way as well. So you articulated a number of issues. So one of the issues is when to bring something, and I think I would trust your judgment implicitly in that. So I don't think that you should...
Change is hard, and I feel very confident that when we bring accurate data, particularly accurate data about our own population and the care that we've provided, that when our colleagues and my colleagues within the Minneapolis Heart Institute see that data, they're very open and receptive to changing. But there are barriers, there are challenges to making this type of work happen. And every time we come up with an idea, we have to run into those barriers and find ways to knock down those walls. And it's not that people are putting things in your way, it's that we're doing things differently. And as many people have described, it's like changing the engine while you're flying the plane. And it's not easy to do, but it's something we need to do because healthcare costs are really too expensive and unsustainable in the long term.
I'm Lauren Molina. I'm a perinatologist and maternal fetal medicine specialist here at Multicare in Tacoma, Washington. I take care of high-risk pregnancies, so high-risk moms, high-risk babies, or pregnancy complications. Multi-care is a 5-hospital system, and we're geographically spread out from each other, which makes it really challenging to address issues and to stay as part of a system. We have different cultures, we have different patient populations, we have different needs for our patients, different equipment sometimes. And working as a collaborative and working through a collaborative, it allows us to understand those differences between our hospitals. No system can be a carbon copy at each location. They're going to be different. But talking about them and working together to identify things that are working one place and not working somewhere else, it's wonderful to be able to have an open dialogue with the providers and the caregivers at other sites.
Dr. Lauren Molina is one of our maternal fetal medicine physicians, and she's been with us for a number of years. We noticed in our data, and I think she brought this to our attention, that we were getting a lot of morbidly obese pregnant women, and a lot of them were coming to us at the last minute from outlying hospitals. They're tough cases, and they have complications and mortality that hospitals just don't want to see.
Sure enough, we pulled from our data that 60% of our population in obstetrics in our system were obese. We identified immediately that this patient population is our highest risk population that we're dealing with, but yet it was a population that had no guidelines, had no recommendations for care, didn't have the right equipment to take care of these patients because we're in an area of medicine that we've never seen before. We don't know what to do.
She challenged us. She said, "We are a tertiary facility. Isn't this the work we should be doing?" And so with that backdrop, she has been pulled a team together, and we have started to create some of the guidelines for the state of Washington around treating bariatric OB patients.
That is ultimately, I think, what every organization needs is for their workers to know that at the end of the day, the work that they do is going to be rewarded with an outcome. And they will get to that end point, and they will see the work that they've done come to fruition.
Anytime we start to feel that we are at target or at our goals, we are falling behind. When we were looking at our results and looking at our data, and when we're looking at what we have been doing, we are not the best. We have a lot of opportunity to improve. So be able to be brutally honest about where we are and then continue to improve from there. And that's, I think, the journey we're on right now. We'll continue to look at how can we become the excellent, the best of the best in the Pacific Northwest. How can we continue to have that world-class results, outcomes, as well as the exceptional experience that we're trying to put in place to support the community.
For us at Multicare, implementing change is an ongoing journey. Morning, Janine. Good morning.
Good morning, how are you?
I'm well, Susie, how are you? And one of the reasons that I think we've invested so heavily in the ideas revolving around data analytics, and that is ongoing continuous feedback loops. So if you have a highly engaged group of individuals that have come together and rallied behind a vision, there's a good chance they will disengage if they have no insight into whether or not the things that they are doing are advancing us collectively towards achieving that vision. So one example for us in our clinical collaboratives is the integration of the data analytics and the reports that the people at the point of care or the people that are acting on the standards that we've established know exactly how they're performing against those standards and can then determine whether or not they need to adjust for the purposes of achieving the goal. So we've essentially tried to connect the dots for people between what you do on the day-to-day basis with achieving and advancing towards the vision. How are you?
Good, how are you?
One of the things that I think has made our team so successful is a lot of people and a lot of dedicated resources from groups like Information Services and Technology and Clinical Informatics and Finance and our Institute for Learning and Development.
When you have your highest level executives in your organization, your top 10, 12 in the organization support a vision such as a transformational analytics function at your healthcare system, that begins to melt barriers that existed before. You start being able to move across the health system in ways that you weren't able to before. Funding for key strategies, key infrastructure, resources become available and enable you to move that forward. And I think the leadership, they have that vision and they're willing to put the investment into it.
Yes. Transforming an organization is one of the hardest things that anyone can try to do. And if you are a lone voice trying to lead something, you may just end up being that lone voice. You have to be smart. And it's building support as you go along. And sometimes it's a very slow process to get there, but nothing takes the place of enthusiasm. And if you've got a good idea and it's believable, you will get people to support you.
When you go to a system and you're trying to make change, you have to have that solution, or at least your idea of the solution. It might not be the final solution, it might not be the right solution, but you're identifying the problem, you're showing them the problem, and you're showing them a possible solution, and that you're willing to work with them for that solution. And if it doesn't work the first time, you go back the second time. Doesn't work the second time, you go back the third time. Because if you know that change is what's right and what's going to be better for your patients, they will listen, because they can't escape your desire for improvement.
Back in 2004, I was working in an overnight shift, and in walks Mrs. Jones with Jenny at 3 o'clock in the morning. I had now seen Jenny for an asthma exacerbation almost 3 times in the last 6 months. In treating Jenny, I very embarrassingly walked up to Mrs. Jones and said, "Mrs. Jones, did you do everything that was on your asthma action plan?" Thinking that somehow she must have failed to deliver the right medicine or didn't go for her follow-up appointment. To which Mrs. Jones, who was a wonderful, wonderful caregiver, very exhaustingly opened up a folder with 6 different asthma action plans, and every single one of them had a Texas Children's logo on it, and every single one of them were different. And she said, "I don't know, Dr. Macias. You tell me. What am I supposed to be doing?" And I realized at that moment that I needed to be involved in quality improvement, and that I had a calling specific to asthma and asthma populations, and that the solution to providing better care for Mrs. Jones and their family was not going to come from a single exposure to a single patient, but was really going to come from changing an infrastructure. I could have never had that epiphany. I could have never come to that dedication to quality improvement had I not been a physician working in the front lines. And those kinds of exposures, that kind of interaction with a family, with a parent, are absolutely critical to understanding all aspects of the healthcare system.
To transform healthcare in any organization, it has to be a top-down commitment to improving quality, improving safety, to a focus on this work. We cannot go to a board meeting without proving our outcomes, without showing them where we have gaps, without demonstrating the successes of the teams we've put into place. We show them our dashboards. We show them where we are failing, as well as where we are exceeding. That drives the organization to do better.
From a technical standpoint, it's how do we leverage our EMR, I would say. I mean, we have a powerful, powerful tool with EMR and other technologies that we have to leverage. And I think we're still figuring that part out too, because there's so much noise sometimes with the functionality of an EMR and everyone's upset about it or not satisfied. And there's a lot to be said for that. But nonetheless, the tool itself is going to be extremely powerful for all of us to standardize care, to measure what we're doing. I mean, the data possibilities are incredible and endless.
One of the most remarkable things about being in healthcare, and especially in the world of pediatrics, is that everybody goes into this for wanting to do the best thing. And they want to do the best thing for children, right? Who doesn't want to say they're improving the lives of kids? And what makes that easy for us as leaders to be able to change the direction is to really be able to display data. What are the things that worked better? If I look at this patient, no matter where in the system he or she touches, are we doing the right things? Are we providing the right clinical standard? Can I measure that? Am I using that data to help create the next iteration of strategies for intervention? And am I driving the right quality improvement?
Begin to use a tool and maybe get a large population of those.
The how in doing that requires partnerships, requires conversations, requires collaboration. Systems will always be systems. They will always produce data. Correlating data and aggregating data and having the ability to make decisions off that data and research was a part of our mission. Can you imagine being able to collect all this data and have the right research to improve specific challenging outcomes that we haven't been able to do? That's pretty powerful, and that's really where the future is.
Nadia Escaritari, she's a phenomenal teenager. She's had diabetes ever since she was a young child, too early to even remember her diagnosis. And the amazing part about Nadia is that she looks at diabetes as her greatest strength. The part that has been so rewarding to watch with Nadia is that she's used her diabetes for the greater good for others. She's been an instrumental part in motivating other children within our Center of Diabetes. She's written a letter that is in part of our education material that we hand out to all of our new diabetics about what it's like to be a kid with diabetes. She's one of those kids who wears diabetes proudly. Everyone knows she has it. Everyone knows she does great taking care of herself. And she owns her disease, and that's remarkable. I wish that for every one of our children with diabetes. At the beginning, care was greatly varied across multiple different locations of care, multiple different providers of care, uncoordinated, complicated. We've created a phenomenal unit, a diabetes unit, the first of its kind in a pediatric hospital that allows cohorted patient care. So patients come in at whatever level of degree of illness, and they go from both medical management as well as complete education for their disease in one place with one medical team. And it's about delivering that kind of care, delivering it at a high standard, delivering it with excitement and with enthusiasm.
What we've done is kind of regroup. So 80% of our diabetic patients now are being taken care of by someone who is certified in diabetic care, who has really been trained in that, that is their expertise. That really has changed the outcome. They're gonna learn their care better, they're gonna get educated better, they're gonna go home and manage their care better. So some of it is measurable and some of it is not. But ultimately, the outcomes and the lifetime outcomes for our diabetic patients have improved because of that.
You know, medicine before used to be, well, I think it was, or in my experience, or anecdotally, but it's really been the transformation of having data available at the hands of caregivers that allows us to look at data unbiased, to be able to say, no, this is the right path forward, and to get everyone on the same level at a table. We use data for everything, and I think it's essential for where medicine is going. It's about picking the right data, making sure that you find the right metric to measure data from, and that you know that what you're measuring is authentic and true and valid. And once you do, then you can feel really confident about using that data to be able to transform and invigorate change.
To organizations that believe that transformation is too overwhelming, that can never take on that journey because it feels like it's too big, I would definitely say stop trying to boil the sea. If you try to bite off too much at the onset, it will feel completely overwhelming.
The biggest thing you need or have to have is tenacity. You have to not give up and just keep fighting the fight. It's really what has to keep you going because there are so many moving parts to keep aligned.
As scientists, we need proof. We need proof of a problem to be able to generate a solution, to implement that solution, and then get data to see if it worked. And I think that is what healthcare is all about. That's what research is about. That's what change is about.
It's not transformational if you have to ram it down somebody's throat. Transformational leaders at Multicare have a unique talent for seeing things differently in the future, and they're willing to take some risk in order for that to happen. They can stand alone with an idea that nobody else embraces and will take their time to help others understand their position. I think that's transformational because it means you have to be willing to be patient and take the time to get there.
The transformational mindset really starts with a willingness to be open to change, a willingness to make things better.
A lot of healthcare is scientific and technical, but to really make change, it's changing hearts and minds that make change and transform organizations. I think the ancient proverb said, if you want to go fast, go alone. If you want to go far, go together. So I think one of the most important things is how we actually interrelate in this work. And if it's work that's driven by meaning, then that's pretty profound.